Hi, this is M. Prasad. Today we are discussing about the pentose phosphate pathway. So this pentose phosphate pathway is glucose. This starts with the glucose 6 phosphate. So it is it will be a glycolysis pathway. One of the part so it will say like distribution like distinguish glucose 6 phosphate to 6 phosphogluconate to ultimately pentose phosphate. So glucose this is the pathway how we are showing now. So functions of NADPH productions reducing power carrier synthesis pathway, roles like as a cellular antioxidants, ribosynthesis, nucleic acids and nucleotides. The characteristic tissue distribution demand for the NADPH biosynthesis of pathways like fatty acid synthesis occurred in liver, adipose tissue, memory and also cholesterol synthesis in the liver. Steroid hormone synthesis in adrenal, ovaries and testes. Detoxification like cytochrome P450 system, liver, reduced glutathione as an antioxidant like RBC, generation of supraoxide neutrophils. The characteristics like oxidative and non-oxidative phases. The oxidative phases reactions producing NADPH, irreversible non-oxidative phosphates produce the ribose 5-phosphate and reversible reactions feed to the glycolysis. So how this diagram shows about glucose 6-phosphate to 6-phosphogluconate to and lactinate and ribulose 5-phosphate intermediate pathways and progressive. Here is nucleotide synthesis will be occurred. So NADPH produced reactions like glucose 6-phosphodehydrogenase. So this enzyme is required to the two enzymes here. Then another one is 6-phosphogluconate dehydrogenase here. NADPH is produced ultimately the pathways final assumption. The pentose pathway phosphate pathway non-oxidative phases here is non-oxidative phases ribulose 5-phosphate to ribose and also here is pseudoheptulose, erythrose and glycolysis. Ultimately it is undertaken to glycolysis and here is NADPH 6 NADPH is produced about these mechanisms of non-oxidative pathways. So what are the regulations here? Glucose 6-phosphatase dehydrogenase and first step and rate limiting sticks allosteric regulation feedback inhibited by the NADPH and inducible enzyme induced by insulin. What are the roles of NADPH in the RBC? Productions of superoxide dismutase and also both oxidative and heteroxyl can be produced reactive free radicals like damaged cells, membranes and the causes of hemolysis. Detoxification of superoxide dismutase, anion and hydrogen peroxidase. Then antioxidants like superoxide dismutase and glutathione peroxidase and glutathione reductase. Here is we can observe very glutathione reductase and also glutathione peroxidase enzymes. So ultimately glutamine cysteine reduced and is finally oxidative stage here. Then what are some of the cases we can study about these things 21 years male medical students with malaria treated with precmin and this is the 4 days later and black color urine and low RBC count elevated the reticulocyte count RBC with the hinge bodies low hemoglobin elevated serum bilirubin and PT record in the few days. Glucose 6-phosphate dehydrogenase deficiency and hemolytic anemia, most commonly genetic angiomopathy, 400 variants glucose 6-phosphate dehydrogenase deficiency and medium term Asian African descent and 400 million people affected worldwide, 50% of Caucasian men and 10 to 14% African American men with the glucose 6-phosphate deficiency. Worldwide distribution of glucose 6-phosphate deficiency is 1995. Glucose 6-phosphate deficiency it is considers prevalence of malaria glucose 6-phosphate deficiency may be important some degrees of malaria or restless also sickle cell anemia. What are the genetic variations here? Recessive sex linked mutations and sex chromosomes rare in female 2 X chromosomes and homozygous mutation high hemolysis and anemia heterozygous mutations normally assumption unless exposed to the pyracmin and anti-malarial drug compost of favapine that produces the superoxide or hydrogen peroxide. Inheritance of glucose 6-phosphate deficiency here. Glucose 6-phosphate deficiency exposure to anti-malarial drug and premiquinine results in increased cellular production of superoxide and hydrogen peroxide and premiquinine sensitivity, other chemical known to increase oxidant stress, and sulfonamides, antibiotic, aspirin, and non-steroidal anti-inflammatory drugs, and quinine and quinine and naphthalene, metabolin like favobin and vaccine and isoprene. Favobin grown worldwide, important in Middle East, high in proteins for frost resistance, and perennial and genetically modified favobin being developed low in vaccine and Israel facing. One of the case study, you can study about the 21 years medical students with malaria treated with the premiquinine. 4 days later, black color, low RBC count, elevated with reticuloendocytes, and also RBC hinge bodies, and low hemoglobin and elevated with the serum bilirubin. PT is recorded in few days. So symptoms like black colored urine and also hemolysis may result in urinary excretions of hemoglobin. Low RBC count and low hemoglobin result in high rate of hemolysis, elevated bilirubin catabolism of heme. RBC with hinge bodies and precipitation of hemoglobin due to the disulfide bonds formations of between the hemoglobin molecules. And upper photo shows it is shown distorted RBCs with the large hinge bodies. Bottom photo shows RBC stained with the methylene blue. So elevated of reticuloendothelial reticulocyte cycloids RBC contains granules or filaments representative an immature stage in cell development. Normally, it consists of 1% of circulating RBC. Reticulocytes, elevations of reticulocytes inductive of active erythropoiesis in RBC bone marrow. What are the defective? Glucose 6-phosphate defective results enzyme with the unstable structure. Patients with the 10% of normal activity enough to generate the NADPH under the normal conditions. Newly made RBCs have normal 6-phosphate dehydrogenase activity. Patients recover quickly 8 days. Thank you. Today we are discussing about the HMP shunt pathway. What are the defectives and diseases, these things, symptoms, case studies. Thank you very much.